Welcome, everyone. My name is Tammy Merrill. I am the Senior Clinical Consultant specializing in temperature management.
And hi, everyone. My name is Hannah Fox, and I am our marketing lead for our temperature management products, which include Ultrix and Mistral Air.
We are so excited to be with you today and looking forward to discussing the latest on temperature management guidelines as it relates to the recently released American Heart Association advisory statement, as well as the importance of maintaining normothermia in the OR. So let's get into it. Ever since the 2013 study, the first since the original temperature management studies, the TM world has been in turmoil. Our professional organizations and the American Heart Association haven't given clear guidance on how to interpret the findings and put them into practice. This has led to a lot of confusion in TTM practice regarding what the best approach should be. We are here today to provide some clarity.
So now let's talk about the elephant in the room. Do we still need a TTM device? The answer is yes. The AHA Advisory Committee concluded that fever prevention is reasonable in a certain subset of patients, but that some patients may benefit from temperature controls determined at a provider's discretion. In high acuity situations, simplicity is key for the caregiver. Ultrix is not only very straightforward to set up, but also offers simple, quickly initiated therapy through its guided touchscreen navigation.
We know that normothermia in the peri-op environment is important for our patients. Let's talk a little more about that. We will define normothermia and hypothermia. We'll identify the causes and symptoms of hypothermia. We'll identify specific populations that are at risk of becoming hypothermic and talk about how technology can help us. Now let's talk about our OR patients. The average patient experiences a 0.5 degree to 1.5 degree decrease in core temperature in the first hour of the procedure. Research has shown that up to 20% of patients experience unintended hypothermia. This is due to multiple factors: contact with the cold surface, exposure to the cold temperatures in the room, and alteration in thermal regulation mechanisms due to anesthesia. Cold-induced vasoconstriction is inhibited by the anesthesia. Some of the complications of hypothermia in the OR patient include increased perioperative blood loss, platelet dysfunction, and need for transfusions. Some research has shown up to 20% increase in the need for transfusion in a hypothermic patient. Hypothermic patients are also 3 times more likely to experience a cardiac event, such as arrhythmias or ischemia. They're also 3 times more likely to experience a surgical site infection. There's an increased peripheral vascular resistance, as well as decreased drug metabolism and impaired renal function. AORN and other professional organizations have stated that we should pre-warm a minimum of 30 minutes before surgery. This allows the periphery to vasodilate and may prevent the redistribution of thermal energy in the OR. Warming techniques maintain intra-op temps when patients are already vasodilated. If not pre-warmed, intra-op warming is ineffective in preventing the initial fall in temperature. There's been a lot of discussion around cotton blankets versus forced air warming devices. Research favors the forced air warming over cotton blankets. 1 layer of cotton blankets decreases heat loss by about 30%, and additional layers did not help. Forced air warming blankets achieve normothermia faster than with cotton blankets.
Our diffusion technology reduces floating and lofting and minimizes airflow disruption. This leads to improved patient comfort and overall linen reduction. We see linen use reduced by an average of 86%. Our reflective technology holds up to 80% more heat and allows for passive warming during patient transfer.
When you registered for this webinar, we asked you to share your thoughts, your concerns, your questions about temperature management. Tammy and Hannah have given us a great overview to get us started, but we really want today's presentation to focus on what will help you provide the best patient care. To that end, the bulk of our time today will be devoted to answering your questions.
Thank you for watching this webinar preview. My name is Julie Cullen, the Managing Editor of American Nurse Journal. I invite you to watch the full version of this free on-demand webinar. Just follow the link in the description. You can also visit myamericannurse.com for a full collection of our free webinars. Thank you.